So ironically, the reason Foggy's world tour came to an end was because of COVID-19. But because of COVID-19, there may well be a greater need for that research. Now, there's an awful lot of ifs, buts and maybes surrounding coronavirus, but there's also an awful lot of ifs, buts and maybes with ME. Because of our lack of research, I can't definitively tell you that COVID-19 will trigger ME in normally healthy people. I can't tell you that. But what I can tell you is that it is known that ME has been triggered by SARS, by bird flu, and by swine flu. So it's all very trying not to panic people. But to be honest, most of you don't know what ME is anyway, so you're not likely to get panicked. But you need to be aware that post-viral illnesses exist. A percentage of people that have post-viral illnesses go on to develop ME. And it does take an incredibly long time to get a diagnosis. It took me 2 years. There is no blood test worldwide to diagnose ME. So many patients, 2 years is quite early actually. Some patients it takes 5, 10, 15 years to get a diagnosis. It depends if you have an ME aware GP. I posted last week the results of an online survey amongst GPs in the UK. A majority of GPs in the UK believe that ME is psychological, which it's not. The World Health Organization in 1969 categorized it as neurological. Since then, on the research funding that we do get, which isn't a lot from government, we're mainly funded by charitable donations from patients and their families, because patients and their families are really the only people worldwide that fully understand how devastating ME is. But most of us can't work, or if we can work, it's only part-time. We struggle to get disability benefit if it's available in our country, and we're living on the breadline more often than not. We cannot afford to keep funding ME research, even though it's desperately needed. That's why I set up Foggy, and that's why I created Stripy Lightbulb, CIC, because the patient community will not only benefit from awareness, we now need education, because we're being failed in every single aspect of our lives, whether that's the government message in the UK is that ME is psychological. Any research they give us, which isn't a lot, really not a lot, it's a fraction of what MS or HIV/AIDS gets, but we have at least double the amount of patients in the UK and no treatment, no diagnostic test. And the money that we do get goes to psychological research. We learn how to effectively deal with our illness. We don't feel quite as rubbish mentally every day. Doesn't take away the physical symptoms though. Physical symptoms like pain, skin rashes, extreme headache, slurred speech, cognitive issues, none of which can be explained by ME being a psychological condition. The biomedical research that we have had done has proven abnormalities in our blood cells. The shape of our blood cells is abnormal. That cannot be triggered by a psychological condition. Our guts have abnormalities in them. The bacteria doesn't work the same way. And also in our brains. Part of Stripy Lightbulb's training includes footage of brain scans. There is physical evidence of inflammation in ME patients' brains. The only reason not too much research has been done on that is because you have to wait for a patient to die to do that research. You'd be shocked by how many patients are willing to give their bodies up once they die for research, because we desperately need something to change. And in our situation, the only way to change it is to chuck money at it. We have absolutely fantastic researchers worldwide that have had to give up their ME research because they simply cannot get funding for it. So in terms of COVID-19, this morning I had a tweet from Cure ME. I've got a very good working relationship with Cure ME, and I think they're absolutely fantastic. Now, as I've said, there's lots of ifs, buts and maybes, but they've now said that the need for ME research is even greater because the numbers of people affected by ME may well increase across the globe. So if you can donate to Foggy's fund, it is going to Cure ME, whose research reach is global. They have an ME/CFS biobank, so bits of patients' bodies are held in the biobank once they've passed away, and also donating blood and things like that while we're still alive and kicking. They have access to so many resources and researchers. If you can donate, please do, because if you are an employer and you think none of my staff have got ME, 1, you don't know if they've disclosed it, 2, you don't know if they're undiagnosed, and 3, there is the potential that your staff in future will have ME. 1 in 500 people have ME. No one knows why a virus triggers ME in one person and not another. Don't know why that is. That's why we need research. We've already got 17 to 30 million people worldwide with my condition, and I'm very lucky. I don't look like there's anything wrong with me, but I can only work 20 hours a week before my body just stops functioning, and I now only function 50% of the level that I was at pre-ME. That means no social life, barely any, maybe once every 3 months. Any meetings are kept short because I can't function for long periods of time. It's a significant illness. I've only got mild ME. There is moderate, severe and very severe. If I was a severe patient, I wouldn't be doing this video now. ME needs to be taken seriously. And yeah, we are jumping on the bandwagon of COVID-19 because COVID-19 may well trigger ME in more people. I wouldn't wish ME on my worst enemy, and there are a lot of people that have treated me very badly because of my health, the stigma and the disbelief, but I wouldn't wish my ME on you if you've ever said anything even remotely negative to me because of my health. So if you can donate, please do, because it may well help you or your loved ones in future if you are unlucky enough to be 1 in 500. Thank you.